This is Seema. Her nephew, Dr. Raza, is an endocrinologist at HUP and also one of our clinical mentors. When we first met with Dr. Raza back in September, he shared with us a personal story about his aunt. He told us that one day she noticed an open wound on one of her feet. She scheduled a doctor's appointment about it for the following week. However, before she could even go, the wound grew larger in size, became infected, and unfortunately she passed away. This story illustrates just how aggressive the timeline for foot ulcer formation really can be. To get into the literature, pressure ulcers will take around 24 hours to develop after initial skin injury, but up to 5 days to become visually apparent. Additionally, diabetic foot ulcers are a subcategory of pressure ulcers that can develop in the span of just a few hours. This timeline is very aggressive and is of great concern. To put this concern in perspective, approximately 554 million people worldwide are diabetic, and this number is only expected to increase. Additionally, of these people, 83 million will develop ulcers, and 17 million will face serious ulcer-related complications, including amputation or death. The reason these ulcers are so difficult to detect early on is because diabetic patients experience elevated blood glucose levels, which will in turn lead to nerve damage and ultimately cause complete numbness in the foot, to the point where even stepping on a sewing needle, as in the x-ray shown here, will not be felt at all by the patient. Additionally, this numbness can lead to excessive loading of pressure on certain areas of the foot, which will also speed up the development of ulcers. Thus, the need for an early detection system for foot ulcer formation is of the utmost importance.
This brings us to our solution. Our solution is Pedalytics. Pedalytics is a comfortable, rechargeable sandal designed to continuously monitor foot health via a novel 3-sensor system. The Pedalytics sandal combines temperature, oxygen saturation, and pressure metrics in order to determine if an ulcer is forming. These 3 metrics were chosen since an increase in temperature, a decrease in oxygen saturation, and an increase in pressure are all associated with ulceration due to the numbness previously explained. If we notice a change in any of these sensors in day 1, we can intervene in day 1 as opposed to day 5 when the signs of ulceration finally become visible to the naked eye. In tandem, these 3 metrics would be able to give us the most accurate indicator of ulcer development, and also no other product in the market exists that currently combines these 3 metrics. The sensor readings are taken as inputs by an Arduino microcontroller and then sent via Bluetooth to an associated app in the user's phone, where data is processed and sensor maps are created. There is also the option of sending data directly to physicians, and the patient gets alerts if there are any deviations relative to baseline. The sensor data is collected every hour, since the literature suggests that it can take only a few hours for ulcers to begin to form. This brings us to our solution specifications. To discuss a performance, we intend for all of our sensors to work with a 95% accuracy under different scenarios of everyday life that Ananyaa will then explain. We also want the sandal to prevent 90% of microtrauma injuries in the foot. To evaluate comfort, we want the user's pedal area not to be irritated by the sensors after 12 hours of wear, and the padding thickness of the insole to be comparable to other orthopedic insoles. And finally, we want our user interface to be easily interpretable by 90% of users with a setup time of less than 20 minutes.
Thank you. And so to meet our design specifications, we developed a sandal that will have 3 temperature sensors, 3 pressure sensors, and 1 pulse oximeter. And this measures blood oxygen saturation. These are placed in the heel, toe, and motor-torsal regions of the foot, because this is where 90% of foot ulceration actually occurs. And this is due to the increased pressure loading we put on when we walk around normally. So our hardware progress began by choosing and verifying each of the sensors. We interface all the sensors at once, and since we only need 3 of each temperature and pressure sensors, this allowed us to minimize the circuit footprint. And then we shrunk it even further by using multiplexers, which combine the output of multiple sensors into one. And then we actually further switched our temperature sensors from infrared to thermistors, which allows us to use a single multiplexer for all 6 sensors. Now that we didn't need a pin for each sensor in the microcontroller, we were able to use the smallest one on the market called the Arduino Nano BLE. And so this is our final thing with all of them working in tandem, and we just put that outside of the shoe. For our software progress, we began with a pre-made app called Light Blue that directly worked with the Arduino IDE, and then we created our own app using Flutter and with Android Studio, which works with our Arduino code as we previously described. We were finishing up by refining the user interface, and we want to add notifications abilities, which we just did. One of the big challenges was our Bluetooth capabilities. And so our first major milestone was actually making it work with Bluetooth Low Energy.
Here we're going to show the functionality and the user interface of the app, as well as show how the notifications display to the user once they exceed certain threshold values. So, starting here with the oxygen saturation, we can see 3 different metrics, the current, previous, and the 10-hour average, and each of these values are updated on an hourly basis. Next, for pressure, we have a map of the foot showing where each of these sensors are, and by selecting one of them, we can see again the current, previous, and 10-hour average for each one of these sensors. And then similarly for temperature, we also have a map showing where each of these different sensors are, and we get different readings for each of these. Moving on to the notifications, as you can see here, the notifications also display when outside the app as well. But for here, as you can see, our threshold here is 95% for the 10-hour average, and once that drops below, we get a notification at the bottom telling you to notify the healthcare provider. Next, for temperature, similarly, we get here, once the temperature exceeds 39 degrees Celsius, we get a similar value also indicating which sensor it's been detected on. And finally, for pressure, when an excessive load has been detected on one of the sensors, we get notification telling the user to correct their foot placement.
To ensure that all of our design specifications were met, we had our sandal undergo testing and evaluation process. First, we confirmed that the temperature sensors were giving us accurate readings through the EcoFlex. To do this, we put our finger in hot water and then touched the commercial thermometer and the Pedalytics temperature sensor. We can say with 99% confidence here that our sensor values are within standard. We repeated this procedure with cold water, and again, we got a confidence interval of 99%. We then repeated the testing with our oxygen saturation sensor and compared it to a commercial oximeter. So we can say here with 95% confidence that the sensor that's embedded in our EcoFlex matches the commercial oximeter. We also wanted to confirm that the alerts did not trigger just during everyday activities and only occurred during ulceration. To do this, we took a brisk walk, a hot shower, and we sprinted, and we measured the basal temperature of our foot at every 10 minutes post these activities. We found that the 2-hour average of our foot temperature after doing these activities was below 39 degrees Celsius, and recall that that is the temperature that's needed to trigger a temperature alert. And so we know that these alerts will not be triggered during these everyday activities, but will only occur when sustained temperature or any other metric occurs during ulceration. Lastly, we wanted to test the ease of use of our app with a cohort of physicians and other local users. We asked them how well they understood the app display and how well they understood the setup of the device based on our user manual, with 10 being the highest understanding. We got very promising answers here with 8.5 out of 10 and 9 out of 10 for the app and the manual respectively. So here we can say that we know our device is able to be easily understood by lay people. As we go forward, we want to refine our display and UI, obtain an IRB to test on diabetic patients, do longitudinal testing on patients with ulcers, and lastly, personalize the baseline values of the app to each patient so that the device can be used for everyone as a personal tool. We would like to extend a special thank you to our mentors at Penn Engineering and Penn Medicine, without whom we would not have been able to validate our design. And additionally, we would like to thank the Innovation Fund and the Berkman Fund for supporting us with grant funding during this process. We would also like to thank the Venture Lab for accepting us into their retail cohort and into their program and giving us the resources we need to carry this venture out. So together, we want to help save the lives of patients like Seema. Let's step into a brighter future with Pedalytics. We're the Pedalytics team, and we're happy to take any questions. Thank you.
Thanks, guys. I thought it was a really clear presentation, and just having some familiarity with the space, I know it's a huge problem in diabetic foot ulcers. You're probably aware of this company, but there is another solution called Pedalytics out there, and once a day, smart mats. You don't have to wear it all day. Curious for your take on why a solution like this, where you'd have to maybe wear it more often, would be preferred over something like that.
Oh, yeah. So I actually spoke to the founder of Pedalytics while I was designing this idea. And basically, it's a great product. But when we spoke to physicians, what they found is that they really needed a tool that was doing any sort of continuous monitoring remotely. So they said any device that we can produce that enables them to not have to be always watching out for a patient is the most valuable thing. Additionally, if they step on the mat once a day, their readings could be elevated for any reason. As we showed, in our alert testings, after just doing activities, like everyday activities, we found, increased readings across the board. So if they just step on the mat after this, it'll give them an alert. But for us, as we're monitoring them continuously, we know that, we're only detecting ulceration specifically. Additionally, we have a combination of sensors, so temperature, oxygen, and pressure. Pedalytics only has temperature, so we have a more robust validation process.
And just to add on to that, when we shadowed doctors in the clinic, something that they expressed was that patients need to wear some sort of protective shoe at home, that they're not doing so. So we intend to prevent microtrauma injuries with our shoe as well.
I think it just turned on. It just turned on. Wait, hello? Okay. Great presentation. I was wondering two questions. One, how is the device powered? Do you have to recharge it? Would you do that when you're sleeping? And then also, have you thought about making it more of an insole or something that could transfer to different shoes as opposed to having users just wear the one type of shoe throughout the day?
Yes, I can answer the insole question and then pass it to Quincy for the battery. But as for the insole, we were thinking of that initially, but the insole, as you put it in different shoes, it can slide around the shoe and have the sensor placement not be as exact as we want it. So it won't be hitting these three regions, the heel, toe, metatarsal, that we said are the most susceptible to ulceration. So rather than having an insole, having a shoe is better. And then ideally, or also additionally, as María mentioned, a shoe is needed to be worn to prevent microtrauma. And diabetic patients don't wear the shoes currently, so we wanted to provide a product for them that they would actually use to not only detect ulceration, but also to stop it by stopping the spread of microtrauma.
And then for the battery, it's just the thing with this circuit is it is pretty big and bulky, so it is hard to find a normal shoe that you can just wear around and insert an insole like that. So we kind of had to move towards making our own shoe, our own at-home sandal. And for the battery itself, it is going to be a rechargeable battery, and there's nothing special about it. It's just a basic one, 5 volts. We're just wall plug charging. The only difficulty with that is just having an outlet in the shoe. So we have to design it into it, and that was it.
Yeah, and the battery lasts for 10 hours, so they can wear it continuously during the day, and then they do just charge it at night. So that's the rechargeable aspect.
Thank you. Hey guys, loved your project. What I was wondering is, especially with all the clinician feedback you had during your design, one thing that occurred to me watching this was that my own mother has terrible feet, and feet can have so many issues with them, like bunions, really thick calluses, existing deformities in diabetic patients, which makes me concerned for how the pulse ox sensor might work. So I was wondering, what are your thoughts on that? What are the clinicians' thought as far as the generalizability to different patients?
Yeah, so when we spoke to physicians, basically the important aspect about oxygenation with ulceration is that you won't notice it immediately, but over time, over a couple of days, you're going to start noticing levels decreasing at a time. So that'll be the case for anyone, even if it's not an immediate detection due to some deformity. You'll notice that in the long run, there's just not enough oxygen going to the foot, no matter who it is, as that's the nature of ulceration. So that sort of, makes it a little more standard and applicable to anyone who might be developing an ulcer.
Also, as we mentioned in our next steps, we'll want to do testing on patients that we would be making this product custom for. So I think that's a really excellent point that you bring up, and we'll want to see in patients with calluses or bunions if oxygen saturation differs for them. But then additionally, once we are making these products custom for them, we'll want to take baseline measurements of what's their average oxygen saturation when they don't have an ulcer, and then over time, once that average decreases, then that's indicating that there might be something wrong. So we will do some customization at some point, depending on who's using our product. So thank you.
That's all the time we have for questions. Thank you.